Hello, and welcome to this Vantage webinar in partnership with ACEVO. Today, we'll be talking you through the key strategies you can implement to help you achieve a successful digital adoption in your organization. My name is Tom Bradley, and I'm the Chief Executive at Vantage Technologies. And prior to joining Vantage, I was the Managing Director of a software company that provided electronic patient records. Prior to that, I spent 15 years working in the charity sector in various technical roles. And a big part of my roles in the charity sector involved sourcing and successfully implementing digital products.
My name is Morgan Pickering, and I'm the Customer Success Manager here at Vantage. And my role is to ensure our customers have a successful implementation and are supported from the point of joining Vantage as a customer throughout their implementation journey and beyond with ongoing support.
So just before we start talking about the key strategies to assist you with digital adoption, I just wanted to give you a bit of context about Vantage, who we are and what we do. So Vantage supports over 130 charities in the UK with our software. And on the screen, you'll see the different modules that our software provides to our customers. In terms of the sectors we support, in addition to the charity sector, we support a range of healthcare organisations, ranging from private hospitals, hospices, care homes, addiction clinics, and mental health organisations. We also support the public sector through local councils and police.
It's important before we look at how we ensure successful digital adoption that we understand what that actually means. So, digital adoption is the process by which individuals or organisations fully integrate and use digital tools, technologies, and systems to achieve specific goals. Today, as we're going to be talking through digital adoption, we're going to focus on it from probably the most popular perspective, which is looking at it from adopting a software package. But conceptually, what we're going to be talking through also applies to all aspects of digital adoption.
So to start with, why would you look at digital adoption in the first place? Why is it important? So first and foremost, let's look at this from the reporting and data analysis perspective. So as you all know, the ability to report on different functions within your business is crucial. It gives you an insight into how your organization is performing, but of equal importance is where it's not performing. And how can we improve that? Well, your data is that insight into your business. And if you're working off paper processes or your data entry point is a spreadsheet, for example, the ability to report on data and to analyze it, especially in real time rather than retrospectively, is limited. And one of the things you want to be looking for with your digital adoption is making sure that you're setting yourself up from the start so that your reporting and data analysis is there at a touch of a button and you're proactive about it rather than reactive.
Following on from Tom's point on reporting and analysis, all organisations, regardless of the sector they're in, will all have different compliance standards that they need to adhere to. So if we're in the healthcare sphere, we might be looking at CQC compliance. You might, in addition to that, be looking at your data compliance and regulatory compliance. And being able to evidence your compliance against those regulatory standards, we need to have the data and the evidence. What we find when we speak to our customers before they onboard software is when they're looking to demonstrate compliance, it's often something that they have to do retrospectively to say, where is our evidence and how do we compile it? Now, when you're looking at digital adoption, what you should be looking for is a system or a process where you're automatically recording your compliance in real time. Not only will adopting software allow you to centrally access your compliance evidence, but it will also allow you to see those shortfalls in your compliance processes. And having a digital solution that can flag this to the relevant people within your organization, you will be able to put an action plan in place to rectify these non-compliances.
So service improvement, Morgan has just alluded to it there. We've talked about reporting and how it feeds into our compliance. But once we've identified those shortfalls in our process, or whichever big business function we're looking at within our software, how do we improve? How do we improve as an organization? How do we learn continuously from these shortfalls that this digital product has highlighted to us? So let's give you a real world example that we've experienced with our customers. So let's look at incident reporting. Often what we find when we go into an organisation that's doing their incidents on paper or spreadsheets is it often takes a critical event for a pattern or trend to be identified. For example, we've had a serious incident at one location, but upon reading through the previous, all of the previous paper notes, we discover that this particular location has been involved in an unusually high number of incidents. Now, what we'd like to see in this scenario with software, we would want this trend to have been proactively identified ahead of time and have our staff informed before we get to that critical point. And I think that's the key thing here, is that proactive approach that you want to achieve through your digital solution that can lead to improving your service. And that's the key thing with all of this, is that proactivity has been driven by the solution rather than your staff having to manually check.
It's vitally important that we have accurate data to not only report on, but to provide as evidence and leverage that data to make accurate and informed decisions. I'm sure we've all experienced where you can't read someone's handwriting or you've misplaced the paper form. So how does software help us with this? So when we look at data input as an example and compare it to a paper form is a free-for-all, and you have very little control over what your staff put on it and the accuracy of that data. Compare this now to a digital solution that automatically captures who is completing that form, guides them through the sections that are relevant to them and their role, and ensures that all of the information required is in the right format. For example, if you want a date add-in, you can ensure the user can only input a date and not just write down Wednesday as an example. And the final point on data accuracy, keep in mind that your reporting will only ever be as good as the information you're reporting on. And it's considerably easier to report on data that we know is accurate from an entry point, as opposed to data in different format on handwritten forms or indeed on spreadsheets.
So everyone watching this will know that the majority of the staff in your organisation are not typically joining your organisation to spend their time on administrative tasks. And the goal that you should be looking to achieve with your digital adoption is that you're freeing up your staff's time to spend less time on administrative tasks, such as filling out paper forms or spreadsheets. So you want there to be a time saving with the digital solution versus the time on your existing process. And again, the same applies with the spreadsheet. Are you having to make sure that someone's completed the information on the spreadsheet? Do you need to forward this spreadsheet on to another member of staff? How are we being proactive about the data that's in there? All of these steps that we've discussed on data accuracy, service improvement, compliance and reporting, all of these aspects, it should be your objective through your digital adoption process. You're ultimately saving your staff time on administrative tasks whilst you're streamlining your operations.
Okay, so we've discussed why digital transformation is important. Let's now look at how we actually achieve it. What are the steps we need to take to get us to our digital solution? So over the next few slides, we're going to be talking through is the steps you need to take. The first one being defining the problem. What is the problem we're trying to solve with our digital product? Researching our given solution, making sure we get the right fit for us and our organization. It's important to set those clear, measurable goals so we can define if it's been a success. Talking through the commitment that we require from the leadership team, and that trickle-down effect to the employees, which will lead on to the communication with your staff to let them know why we are doing this digital transformation. And then finally, we'll be touching upon the implementation, how that should be approached, and also what you should be looking for from a training and support perspective, both before you go live and after you've gone live with your chosen solution.
So looking at the first point that Morgan just mentioned regarding defining the problem, it's important that you consider the problems you're trying to solve and how the digital solution or software that you're implementing is going to solve these problems. Think about the processes that you're trying to replace, whether that's paper, spreadsheets, or even moving from an existing digital solution that's not working for you and your organization. Think about those main sticking points for these processes. Where are the inefficiencies that you're experiencing because of these? And how is that impacting your organization? It's important to identify and understand these problems so that you have a clear path ahead when trying to identify the solution. Now, you might be asking yourself, how do we clearly define the problem? Well, going back over the points we've already discussed in terms of why is digital adoption important, those are the same points that also point to the problems you're trying to solve. So reporting, have we got poor or time-consuming reporting process? Compliance, are we struggling with our compliance? Is it a last-minute rush before an inspection because we have not been able to be proactive? Do I have my staff spending huge amounts of time doing administrative processes that could be done with the digital system? So all of the reasons that we discussed earlier on why is digital adoption important, look at those points to help you identify your problems. And these problems will ultimately help drive your research.
So when it comes to research, speak to similar organisations or organisations that you have links or relationships with and see if they've already solved these problems you've identified and what software solutions do they have in place that have helped them. There's nothing better than a real-world example or scenario. Secondly, use the internet. Now, I know the internet can be confusing, especially if your search terms are broad. However, now that you've clearly defined the problems you're going to solve, your ability to search is going to be that much easier because you'll know exactly what you're looking for and what you're trying to solve. So in combination of speaking to other organisations and doing your research on the internet, we also strongly recommend that you use comparative sites like Capterra so that you can see what other organisations have said about that software package, what works well for them, what didn't work well for them. And finally, take your time and book multiple software demonstrations because you want to make sure that this is the right fit for your organisation. We would always recommend looking at least 2 or 3 different software packages so that you've got a good comparison from a functionality perspective, but also from a cost perspective. It's important to take your time with this phase because this will be a determining factor in the success of your digital adoption process. You need to choose the right product for you and your organisation.
Okay, so now we've identified our chosen solution and we're going ahead with that particular provider, it's really important at the start of that project to set clear and measurable goals because we want to be able to define success and we want to make sure that as we're going through the process, we're achieving what we set out to achieve. So setting measurable metrics or KPIs to track improvement against your goal is crucial at this stage. And when you're looking at those metrics and KPIs, again, let's look back at why we're doing this in the first place. All the problems we're trying to solve should be the basis for the metrics we're identifying. So for example, we might want to see a certain percentage reduction in staff time filling out forms. Internally, it's important to have regular reviews throughout the implementation process, but also after your implementation, when the actual measuring of metrics and KPIs will start to take place. This ensures we're checking your digital solution is actually solving your problems, and staying in touch with your new supplier throughout this process is key and ensures that you work together as a team to meet your goals. It's important to be upfront with your provider at the beginning and during your research period to define what problems you're trying to solve. And again, this feeds back to research and why it's so important to pick the right provider. So in my previous role, we were providing electronic patient records, and more often than not, we were going in and replacing paper processes. Now, regardless of how good the solution is, there is always going to be internal resistance to change. There will always be those that think the paper form is fine, and why do we now need to use software, for example? And one of the things I learned in my time at that organisation is that communication from the leadership team is absolutely crucial. So first and foremost, you've identified the goals and the problems, but it's really important that as leaders within the organisation, you communicate this clearly to your team. These are the problems we're trying to solve. These are the benefits that you as employees will see in terms of a time saving, but also this is how this is going to improve the organisation. This is how this is going to make the organisation more efficient, more responsive, and how it's going to help us improve the service that we provide. So that top-down leadership commitment is essential, and the previous steps we've talked about in terms of defining the goals and researching our problems, all of that feeds into this. So once you've gone through those previous stages, it then becomes that much easier to spread the message about why you as an organisation are doing this digital adoption. And that really helps with the resistance to change that all organisations have at all levels. And finally, it's important that the leadership team themselves show commitment to the digital solution that you're adopting, and where possible, that you're using it in your day-to-day operations. And then that helps embed a culture that sees the software as an essential tool in your organization.
So this follows on nicely from the leadership commitment. So looking more depth at the communication phase. So whilst it's important to emphasize to your staff what you're doing, why you're doing this project, and the importance and the benefits that the organization is going to get, it's important that they have a voice. So give your staff an opportunity to give feedback and share that feedback with your provider, because that might influence or change how the implementation is going or the type of solution that they're ultimately trying to give you. It's also important to clearly communicate with all of your staff what their responsibilities are, both during the rollout of the software or also once the software has been rolled out. We always recommend that you have an internal project manager who's going to be managing the process and being the key liaison with the supplier. So if you're looking at changing the process, make sure that the people that are involved in that process have a voice, so that when the software is rolled out, they feel that they're being part of that process and you have less of that resistance to change because they've helped to be part of the solution. Again, looking at the KPIs that we put in place, provide regular updates to your staff so that you can demonstrate as an organisation, we've now seen that you are spending X amount of time less on filling out paper forms. We're not printing all of these pages anymore, and our service has improved in the following areas because we're able to be more responsive. Again, feeding back. That's why it's important to identify the problem and define those metrics, because that's going to be part of your feedback and getting that continuous buy-in from your staff.
So we're now at the point of actually implementing our chosen software solution. So first and foremost, ensure that your provider has a clear and structured implementation plan. You want to know what's required of you at each given stage as an organization. And again, for the key players in your organization to know what their obligations are. To make this implementation a success, in terms of timescales with your implementation, there can often be a feeling of, let's get this done, let's get it done quickly. And that's typically not the best approach to take. Take your time. You spent the time defining the problems and setting your goals. Now make sure you give yourself reasonable timescales, because at the end of the day, typically your staff have their day jobs to do in addition to now having to onboard a system. So make sure you build in enough time for your staff to provide the supplier with the information that they need to make this a success. And much like the KPIs and the milestones that we've talked about that you'd be providing your staff with once they've implemented the software, it's also really important to have measurable milestones throughout the implementation that you've agreed upon with your supplier. So for example, we've agreed upon our training dates, our product acceptance dates, and ultimately our go live date.
So we've implemented our software package, but it's important that the training and support is there for the staff. A big part of my role here at Vantage is ensuring that our customers get the support they need, both ahead of going live with our software, but also after. It's also crucial that your staff have adequate training on this new digital solution. What will happen if your staff haven't been given the relevant training? Well, they'll either use the product incorrectly, which then cancels out all the benefits that you're anticipating having. And if they're not trained correctly, that you're going to have a staff buy-in drop-off quite quickly, because they're not going to want to use the product because they don't understand it or they can't see the benefits. So training is absolutely essential. Make sure that your provider gives you a good structured training plan. One of the things that we typically recommend at Vantage is try and adopt the train the trainer approach. Have some champions in your organization that really understand the product, so that during the day-to-day, the rest of your staff have someone internal that they can go to that can provide them with assistance. And again, this feeds back to that communication piece we were talking about. Another thing which feeds more into the research side of things here, but consider the customer support being offered to you by your provider. Make sure that you know the support is there. Once you go live with your product, you don't want to be left alone with it. Make sure you have ongoing support with whichever provider you choose, because once you've gone live, there'll be changes you want to make. there'll be lessons learned. Once you're using your product, you will want to further refine it, so it's really important that your provider offers that service. And finally, keep it simple. Try and remove any barriers to the software. So for example, look for things like single sign-on so that your staff aren't having to remember multiple usernames and passwords, which is ultimately going to prevent them from getting into the software. Also look for software where certain functions such as data collection are as streamlined as possible. So again, let's look at instant reporting as an example. Do you want to be able to get your staff to report an incident without even having to log on to the system? It's important to keep it simple and try and make it as easy as possible for your staff, both to get into the software, but also to use it and leverage the training to help with that.
So you now know the preparation for digital adoption, what to do during your implementation, and how to make this a success. So in a moment, we're going to hand over to one of our customers who will share with you some first-hand experiences in adopting digital solutions. But before we do, we just wanted to say thank you. And if you ever do want to reach out to us at Vantage, there should be a QR code on the screen, but also you've got our website on there as well. So do feel free to reach out to us if there's anything you want to discuss with us based on what we've gone through today, or alternatively about any of our solutions. So now we're going to hand over to Kate Pyle, who is the Head of Risk and Compliance at St Leonard's, who will talk through how they implemented our software. But also Kate has a lot of experience implementing lots of different systems across different roles. So Kate's going to give you some first-hand accounts and experience with what she's learned over the years doing implementations.
Hi, my name is Kate Pyle. I am Head of Risk and Compliance at St Leonard's Hospice. We've been a customer of Vantage for coming up to a year and a half now. My prior experience in going live with new digital systems dates back well over 20 years, mostly within the healthcare sector, with systems that were used for the managing of stock, of patient system management, etc. Learning from all of those launches, the key element is the communication with the teams that you're working with, even if there are no particular updates in a given week, to give them we've got nothing new to tell, but everything is still progressing as expected, to set really clear timelines as to when people might be seeing different things on their homepage, on their desktop, to give a sense of what it is the system's going to look like and how it's going to work in really simple bite-sized chunks, so that when you have a system change, people aren't overwhelmed by new interfaces and new systems that they're working with. The go live that we had with Vantage was a transition from a system we'd had in place for about 6 years, with the desire to be able to have a much more robust system from a reporting point of view, to give us a structure where audits were easily built and then the findings extracted to support us in our compliance work, to have freedom to make changes as we needed, to make changes to systems once they'd gone live, because we figured out there would be a better way of doing something, that there was a way of making things easier for the user. And all of those factors were very immediately available with Vantage, and working very much in conjunction with the team in Sheffield to be able to build a starting point for the system. So we had something to go live with, instant reporting being our first module going live. And since then, in the following 9 months since we went live, the expansion of multiple modules to really support us in how we are capturing data right at the beginning, so we aren't having to go back to ask more questions when an investigation is being completed or when looking at audits results, really prompting the user to put the right information from the very start of the process. The real benefit we had in going live, which was very much supported by the flexibility that Vantage provides you, is working within healthcare. where you have the ongoing clinical, non-clinical teams not fighting, but in different priorities, and being able to build the incident reporting modules with a senior nurse so that they could say, this is how a nurse reporting pressure damage, a patient fall, a drug error, etc., would be capturing information, and these are the prompts that we would like to make sure the right information is being collected at the right time. I could also then sell it very, very easily to the organisation, because launching a new system is a challenge, and as lead on it, I was able to say, look, this is a system that has been designed with your needs in mind. We have a nurse who has put the input in, understanding the words you use, the points at which things will become apparent to you. So it was a much more palatable offer to them, rather than me as a non-clinical compliance health and safety expert saying this is how I want it done, which made the launch go so much easier. The support we had from Vantage right from the initial quotes was superb. I followed the process in the same way as Morgan described earlier in the slides, of getting sense checking what our peers, what our colleagues were using in different hospices, seeing what was available on the marketplace. And it was a no-brainer with the offer from Vantage, from flexibility, from fulfilling all the requirements that we had, and also from a cost point of view. It was the best product at the best price, and we knew with the experience with hospices across the country, there was that fundamental understanding of the diversity of risks that are apparent and exist within hospice care, from your retail, your fundraising, the clinical care, and then the behind the scenes compliance elements where my team focuses on it. We have been giving regular updates since we went live on this is how we're improving the system. These are just shared organisationally with no particular formality to them, just very light information. You can use this to do this. We have included this element within this module, just so that people know there is that ongoing design improvement option. Where people have requested minor changes to be made, we've been able to action them within a 10-15 minute window, whereas with our previous provider it would have been a 6-month lead time and several £1,000s worth of work to get those minor changes done. And that flexibility further improves the buy-in that I have from the users of the system, because they can see how easily we can make a change to reflect those little nuances that they want, just to make it easier for them to input the data right from the start. In terms of our training approach, we had training provided by Vantage for the super users, which was a clinical, non-clinical spread of people, and then for wider circulation, developing user guides on a subject by subject matter that were available, shared widely through the organisation, and then some bite-sized videos that I did to talk through, in this module, if you click here, this will happen. If you select that, this happens, etc. I kept them to 3 minutes for those on a busy clinical shift to be able to dip in and out of them quite easily and see what it was they needed to know and how to be able to do it. 9 months on since going live, we are in agreement it's been the smoothest system go live we've had in any of our working careers. It's fully embedded within the organisation. We are constantly getting excited about the different options that are available to us and the improvements as being designed by the Vantage developers. We're currently looking at introducing dashboards for our executive team and senior leadership teams, so that they've got that very easy at a glance information as to where risks are sitting within their department, within their service area. we're really looking forward to the ongoing relationship. We know that we've got a really great working relationship. I know I could call anyone at Vantage and get a quick response if they don't know how to sort something out immediately. Very timely in getting back to me, either with a leave it with us, we need to get the developers looking at that, or let's work through it together. The flexibility that the system has given us has been absolutely key for us, and we're already seeing fantastic outcomes in the reporting that we can feed through to our board and governance committees and clinical governance in terms of the data that is able to be extracted and how we're able to present it.